With breast augmentation, the standard procedure involves placement of the implant in a submuscular pocket. There are times that that implant needs to go in a subglandular pocket, so I do offer both of those types of surgeries depending on the patient's need. Also, sometimes women's breasts after breastfeeding or weight loss or weight gain can develop some ptosis or droopiness, so sometimes a mastopexy or breast lift will have to be done at the same time. That can be done at the same time as a breast augmentation. The advantages of putting the implant under the muscle is that there's some more soft tissue coverage over that implant and it conceals it a little more. That's critical in very thin women that don't have a lot of breast tissue to begin with. I offer saline or silicone breast implants. However, I would say that 99% of people now opt for the silicone. It really has become the gold standard in breast augmentation. It has a much more natural feel and a much more natural look than the saline implants. And the FDA did re-release silicone implants back in 2006, so they are extremely safe. For a patient that's interested in a breast augmentation, the initial consultation, I meet with the patient, I examine them, we figure out what it is the patient is actually trying to achieve, what they're looking for. The procedure takes about an hour and a half, and it is outpatient, so the patient will be going home with follow-up the very next day. The healing process takes about a couple of weeks. The usual time off work, I would say, would be about a week. You're going to be sore after that time, but you can start resuming regular activity. A good candidate for a breast augmentation would be any woman who feels like her breasts could use a little more volume. I do recommend if a woman is about to have a child or is thinking about it in the near future to possibly refrain until after that child, because the breast tissue can change a lot during the process of pregnancy and nursing. A good candidate for breast reduction would be someone who has large, pendulous breasts that's causing back pain, neck strain, those types of issues. Breast reduction procedures can take off anywhere from 1/2 pound to 3 pounds from each breast, and that offers a tremendous amount of relief for women who do suffer from a condition called macromastia or very large breasts. As far as financing options, we do offer our patients care credit, and we have an expert here that can help facilitate getting you into that program.